Good afternoon, St. Lucia, and welcome back to the Command Center for information regarding St. Lucia's response to COVID-19 at the studios of the National Television Network. We continue to thank all our partner television and radio stations who are also joining us for this simulcast. We are here today, Sunday, March 29th, for an update from Prime Minister Honorable Alan Chastanet and Chief Medical Officer Dr. Sharon Belmar-George on St. Lucia's situation regarding COVID-19. Also with us this afternoon is Acting Police Commissioner Milton Daisy. I now hand over to Chief Medical Officer Dr. Sharon Belmar-George for a situation update, who will be followed by the Honorable Prime Minister and then the Acting Police Commissioner. Dr. Belmar.
Good afternoon. Thank you, Ms. McDonald. As of March 28, 2020, the World Health Organization reported a total of 571,678 confirmed cases of COVID-19 globally, with 26,494 deaths. There are now 100,313 confirmed cases in the region of the Americas. On Sunday, March 29, 2020, the Ezra Long Lab at the OKEU Hospital reported a total of 5 new cases of COVID-19. This now brings the total number of COVID-19 cases recorded nationally to 9. Case 1 is a 24-year-old female with a travel history to New York. She was quarantined at home and presented at our health facility on March 27th. Case 2 is a 45-year-old female with a travel history to New York who presented at our healthcare facility on March 24th. Case 3 is a 47-year-old female with recent travel history to Barbados and Dominica. She presented at the healthcare facility on March 27th. Case 4 is a 36-year-old male with a travel history to Barbados and presented to our healthcare facility on March 27th. Case 5 is a 74-year-old female with no travel history or known contact with an individual with travel history. She presented at our facility on March 27th. Given that case 5 has no travel history or known contact with anyone with travel history, this confirmed case points to the existence of local transmission of COVID-19. Aggressive tracing of the contacts of these cases is currently underway by health teams dispatched to the communities of interest. The Ministry of Health has observed that all of these cases were captured through our community respiratory clinics. This highlights the usefulness and effectiveness of these clinics and streamline COVID cases to care in a timely manner. As of the week of March 23rd, St. Lucia commenced national testing for COVID-19. This reduces our reliance on the Caribbean Public Health Agency for testing. Achieving this national capacity has allowed the review and adapting of our national testing protocol to widen the number of persons being tested, as well as to shorten the period of time within which results are received. To date, a total of 139 COVID-19 tests have been conducted. 71 were conducted by the Caribbean Public Health Agency, and 62 were conducted in St. Lucia since commencement of testing this week. All tests for COVID-19 and related treatment and care are free of charge to individuals. St. Lucia, like other countries globally, we anticipate interruptions in regular shipment of testing supplies, and in periods where this shortfall in supplies may occur, arrangements have been put in place to utilize the Caribbean Public Health Agency for testing of samples when necessary. Given the Ministry of Health's focus on positioning St. Lucia to respond to COVID cases, the national healthcare system has been adapted to allow for a more robust response to COVID-19. As such, new pathways to care have been created, and the public is asked to utilize these as required to access care. The 311 hotline is available to provide general information on COVID-19 and access points of care. As of Monday, March 30th, this service shall be available 7 days a week and shall function from 7 a.m. to midnight daily. Also, 40 cell phones have been dispatched to our medical clinical teams. These numbers will be shared later this evening for persons requiring clinical advice from a physician. Persons with flu-like symptoms can access care at their closest respiratory clinic. The 5 existing respiratory clinics are the Grosole Polyclinic, Leclerc Wellness Centers, the Dennery Hospital, Viewfort Wellness Center, and the Soufrière Hospital. The services at the Dennery Hospital, Soufrière Hospital, Leclerc, and Viewfort Wellness Centers are available daily from Monday to Friday from 8 a.m. to 4 a.m. The Grosole Polyclinic is available from 8 a.m. to 4 p.m., including weekends. Respiratory clinic services are available at the Victoria Hospital and the St. Jude Hospital and is to be utilized by persons with respiratory issues requiring care outside of the hours of the functioning of the clinics within the community. All respiratory cases coming into the hospital facilities will be screened and redirected for care as required. On Friday, March 27th, St. Lucia received a contingent of 113 Cuban medical professionals to strengthen our national capacity to provide care during the COVID response. These professionals are currently undergoing a quarantine period to commencement of their duties. The support of the Cuban health professionals shall prove beneficial in enhancing our capacity in managing the response to COVID-19.
Well, fellow St. Lucians, this is another opportunity to update you on what your government is doing to be able to support the Ministry of Health, and particularly the CMO and her staff in their effort to be able to deal with COVID-19. Just a short recap again, that when we started out this process almost 2 months ago, the objective was to delay the introduction of COVID into St. Lucia, particularly at a community level. And also to be able to, as we've heard, flatten the curve, so that if in fact we do have an outbreak, that we manage the outbreak to live within our capacity. 2 months ago, I can say to you that we did not have the capacity to deal with any kind of outbreak at all in St. Lucia. We had limited space at the hospital, and the fact that we were all at VH means that you were potentially going to have both COVID patients along with other patients at VH. And so the decision was made to move into OKEU. And as you know, while physically the building of OKEU has been finished, there are many components to it that were not. And so therefore, over the last 2 months, we have now put more resources to support the transition team. And that transition was successfully completed on Friday. And I really want to congratulate all of us. This is a huge milestone in the history of St. Lucia when it comes to health. I again want to reiterate our support and gratefulness to the European community for this incredible gift. And I want to thank the officers who were responsible for helping us to transition into OKEU. Once that was happened, we're now focusing this week on preparing Victoria Hospital to be a respiratory hospital. So that will include putting subdivisions in, reconfiguring and re-engineering many parts of the hospital to be able to support this respiratory hospital. We've also ordered additional respirators. I believe that 6 of them will be arriving here very shortly, and another 5, if I'm not mistaken, will be arriving 2 to 3 weeks after that initial group. In terms of making sure that the nurses and the doctors are going to be properly equipped to be able to protect themselves with our COVID cases. You will also know that we have converted 3 hotels in order to be able to deal with people who have been in quarantine. So a couple of weeks ago, we realized that self-quarantining was not working. There were many reports of people who were supposed to be in self-quarantine and were out and about. And we got many complaints from people in the neighborhood and the general public acknowledging that this was taking place. And so we made the decision that anybody coming in would now have to go under supervised quarantine. Once we had made that decision, very quickly, we filled over 300 rooms that we had on the island. And therefore, we had to take the very difficult decision of not allowing anybody else on the island, including St. Lucians. And my heart goes out to many of you who have been calling me to see if I could make an exemption. But unfortunately, we do not have the capacity to be able to hold any more people in supervised quarantine. And we've seen that even in supervised quarantine, it's not been 100%. There are many people who continue to breach the protocols that were established, and the resources that were required both from the police and also from the healthcare in order to make sure that we had more stringent supervision in place has added an additional burden to the system, one which we were not anticipating. We also simultaneously made the decision to put a curfew in place, as well as to scale down our non-essential commercial operations, which is separate and apart from our emergency essential services. So our emergency essential services continue to operate at full staff, but on a commercial basis, we have scaled down. And we have now gone through this for the last week. I have to say to all of us that I don't think that any of us would be surprised when I say to you that we have not done a good job of making sure that we're all doing the right things. I mean, the government has made the resources, has put all of the laws in place, has increased the number of policemen out in the field, but many of us have just refused to adhere. There's still examples of people going to bars. There's still examples of people going in crowds to the beaches. There are many operations that have continued to operate flaunting what was required by the government. So this afternoon I have to announce that we are going to have to put more stringent regulations in place. So one, we are going to extend the curfew, which was from 11 to 5 o'clock in the morning, 11 o'clock at night to 5 o'clock in the morning. And as of tomorrow, it will be from 8 o'clock at the night until 5 o'clock in the morning. Secondly, that we're going to extend the period of quarantine, which was due to end around April 5th. We're now going to extend it to April 14th. And the third part to this is that we're going to suspend all liquor licenses in the country. And so anyone who is going to be operating a bar or a restaurant other than a drive-through or takeout will be in breach of the law. With me is the Commissioner of Police, and he'll be speaking shortly, but I've asked him to strengthen his staff and also their level of tolerance. And again, I'm appealing to St. Lucians one more time. This is for you. This is for all of us. This is for the elderly, people in this country who have diabetes, people who have respiratory problems already, people who have hypertension. And we've seen now at the results in Italy, New York, and throughout the States that Corona does not discriminate. There are as many young people dying from this as there are elderly people. And we can't continue to believe that we're immune from what Corona offers us. And some of us are, but there are many of us who are not. And the only way that we're going to defeat Corona for now is by self-quarantining and by practicing social distancing. Now, the Prime Minister of Singapore put it extremely well this morning when he said the off-ramp to Corona hasn't been found yet. that what we're all attempting to do in the world is to flatten the curve, slow down the introduction of cases in order to allow our very capable and very brave medical staff to treat you. Now, if in fact we don't do it, it means that our services are going to be overwhelmed. And therefore, there are people who could be saved and will potentially die simply because they could not be taken care of. Who wants that on our conscience? Which one of us wants to be able to condemn any one of us to death? And I say this brutally, frankly, to all of us, because that is what it is. And I'm appealing to all of us, as difficult as it is. Nobody wants to confine you to your home. Nobody wants to be able to limit what your access is. But for now, the only way that we can slow down the spread of coronavirus in our community is by how well we adhere to these very strict requirements of proper body hygiene and cleaning your hands, staying social distancing, and limiting your interaction with other people. Now, there are certain services that we must keep open, and therefore there are people who are going to have to go out and interact. So therefore, all the people who are at the grocery stores, who they themselves are exposing themselves in order to facilitate us, why do we want to put them in further harm? So when we pass by grocery stores and we see that internally we're handling it, but externally we're not, this is unacceptable. And I've spoken to some of those grocery store owners, and I've also indicated to the police, it's not the policeman's job to go and make sure that you're practicing safe social distancing on the outside. And if in fact people who are lined up outside insist on doing it incorrectly, I've instructed that the grocery store be closed down, inconveniencing all of us, but protecting the people who have come out to try to provide you with that service. Bus drivers, please continue to adhere to the rules that we're recommending. This is for your safety. This is for the safety of your own clients. Now that we know that there is a strong likelihood that we have a community outbreak in St. Lucia or potential spread, how successful we're going to be is in our hands. And you can see the rest of the world is completely preoccupied with their own problems. And that's why we have to be so incredibly grateful to the country of Cuba and to its citizens to facilitate allowing their doctors and nurses to be able to come here at this critical juncture. There are not many other sources that we could have gone to. And I want to thank the government of Bahamas for being so generous in being able to provide the airplane for us. Unfortunately, Cayman Airways went through a shutdown and their protocols did not allow the plane to fly. But thankfully, Air Bahamas was able to address our needs and to bring the Cuban doctors and nurses here on Friday. So fellow St. Lucians, I'm appealing to you one more time. Let us do this thing together. We're all in. How we act and behave is not just for ourselves, but it's for our neighbors, our friends, and people you may not even know, but are our fellow St. Lucians. We're not going to succeed if we don't do this thing the right way. So again, sadly, I'm asking the acting commissioner of police and also the police officers to please step up their enforcement and to reduce the level of tolerance that we have as it pertains to the rules and regulations that we do have. And I will continue to observe and to work and support the CMO and her staff to make sure that we're able to continue to delay the number of people who get cases. But in closing, we knew that this day would come. And I'm very satisfied that what we've been able to achieve so far collectively together is to put us in a better position to be able to fight it. Having a dedicated hospital, having dedicated staff, and now having hospital facilities that at some point, if we continue to see an increase in community outbreak, will now also house the nurses and the doctors and the police officers who are on the front line, in order that they don't have to go back and potentially contaminate their own families, or infect their own families. So again, the plans have been put in place. Let us work together. But the part that the government can't do it by itself, the part that the police officers and the nurses cannot do by themselves, is your cooperation. That's what we need to do. There is no other way around it. There's no way that anybody would want to confine anyone to their homes. And we know the difficulty that that's going to place on the stress in your household. But you're going to have to find ways to be able to make it through this process, because sadly, there is no alternative until a serum or a vaccine has found. And as the Prime Minister of Singapore says, at that point, we will then have an off-ramp to COVID. But COVID is going to be with us for a period of time. What we must make sure we do is to put in social behavior that allows us to maintain a flat line, reduce the number of cases over the period of time, in order that we can give every single person an opportunity to be able to survive COVID-19.
Okay. Good afternoon all. The police have been working, and we have been working hard in trying to ensure that persons adhere to the rules that were set by government. On numerous occasions, we have received calls where we respond to those calls, sometimes going to various establishments probably twice in a day to close them down and so on. I am urging persons to be responsible. Coming next week, or should I say this week, we will not be running around. We do not have officers for that, running around asking persons to desist from doing this. You are aware. Police have warned you, and the coming week is not a time for warning. And I'm serious about it. Persons will be arrested. The Prime Minister has assured me that the fines would be put in place as of tomorrow. So persons would be, I am not in a position to say what fine it is. That would come from Cabinet. However, I could assure you that you can be arrested from tomorrow, and there would be at a minimum of 72 hours in. And please note also that a magistrate, the court is not sitting. However, we have access to a magistrate who has the power to extend your stay in the police station. The custody suite that is at Central Police Station is available. I have ordered that it be empty, so that persons who were arrested and were in there have been taken to Babono, Masha, and Grosile Police Station, just to make that space that is available for persons who fail to comply. I must report that on Friday, that is past Friday at 2 a.m., 2 persons were arrested in Grosile for failing to comply with the curfew. They had been charged and were granted bail. However, I could assure you that in the coming days, it would not be so easy. I must also report that one vessel, a boat, had been seized by the Marine Police. I commend them for such action, and that boat is impounded with them. I must also report that the police, we were busy going out there in search of persons that had come in from neighboring Martinique and who had skipped. Well, obviously they came in unlawfully and therefore were not in quarantine. We have since brought in some of those individuals into quarantine. And I must inform also that we have put together 2 extraction teams, team made up of 10 individuals, 1 in the north and 1 team in the south. And this team would be working directly with the Ministry of Health in identifying persons and then taking them into quarantine. These officers are fully equipped. They are with their face masks, their body suits, gloves, hand sanitizers. So everything that is to have everything that is necessary to prevent that spread. And these officers, I must also inform you that they are from the SSU department. So we have this team that would be going out there. So I'm urging persons as to be responsible. Be responsible. Just obey. The laws are there. It is put for control. Please obey the law. The police have been out there. They are putting their lives in jeopardy so that they protect you. Please help protect yourself. Stay indoors, especially when that time, the curfew time is moved to 8 p.m. There would be no, as I said, there would be no begging, no begging individuals to go home, no warnings. You are not supposed to be there. Please find yourselves at your home. So by the time when a police vehicle is driving the road, there's nobody except emergency services on that road.
Thank you very much, Commissioner Daisy. Thank you very much, Honorable Prime Minister. We have a question for Dr. Belmar. We're hoping that you can explain, Dr. Belmar, a situation which transpired earlier today with some figures which were published on the PAHO website, which contradicted some figures which we released here locally.
Yes, this morning, Sunday, March 29th, it was brought to our attention of a PAHO report dated March 26th or 27th, which indicated that we had a total of 7 cases, and on that date, we had a total of 3 cases. We quickly brought it to the attention of the Pan American Health Organization and also the Caribbean Public Health Agency, who was doing our testing at that time. On noting the error, they were very quick to rectify it and make a change in the document. They also prepared a public apology to the minister because they were aware of the level of stress that it did cause to us and our team. I just want to indicate to the public that the Ministry of Health, within 24 hours of receiving results, we report those results to the public. And we are signatories of the International Health Regulation of 2005, so we have an obligation to report those results to them. We ensure that the public are aware, because it is important that the public knows how, especially for COVID-19, how we progress on a daily basis. So as we have done from our first case up to this point in our 9th case, we ensure within 24 hours we report the cases that we note, and we intend to continue reporting to the public in a timely manner.
Thank you very much, Dr. Belmar. Also, could you just confirm to us the numbers that we are at right now? Just repeat what you had said earlier with regard to the specific numbers we are at as of today.
Yeah, as of today, we have a total of 9 cases of COVID-19. 8 of them are imported cases and 1 case of local transmission. 2 of our first 2 cases have been repatriated to the UK, and all of the 9 cases are clinically stable and are doing well.
Before we close, we have some final words from the Prime Minister.
Again, I want to be able to appeal to all St. Lucians. Fake news doesn't have to be as blatant as some have done, but it can be subtle. And so this subtle effort to be able to undermine the credibility of the government is, in my sense, my mind, also fake news. Your government has made a very clear decision from the onset. All matters as it relates to the health of this country are being communicated to the public by the CMO. CMO discusses with her minister, as well as then includes me, and I can make the determination as to whether we extend it to cabinet or not. But on very few occasions, if any, have we in any way contradicted or attempted to thwart the CMO. The CMO has been driving this process. And I think that we all owe it to ourselves to trust the information that's coming out of that office. The role of my office is to be able to give you policy positions and strategy as a country. And so the next step is to be able to announce a Corona rescue package, which I will announce next week, which will include income support. And if in fact we can overcome the threat of the community spread of corona and keep the spread at a minimum level, that will then allow us to be able to now announce and start a major economic stimulation. But let me say this. Priority number one is to resolve corona. Priority number two is to resolve corona. And priority number three is to resolve corona. We cannot move forward as a country until we curtail corona. And so the quicker that we can adhere to these protocols that have been designed by the CMO in collaboration with CAFA and PAHO, and also with the WHO, and benefiting now from the many experiences we're seeing in other countries, the only way that we can contain corona now is by practicing these simple rules. And nobody's saying it's easy. And we know that it's a huge departure from our normal culture. But it's a necessary step to win this battle. I want to reiterate something that the CMO also said. All testing and all healthcare support for corona cases are free. So no one should be fearful of coming into the hospital because they're concerned about the cost. Also, in speaking to many people in the community who believe that they have their own concoction to fight corona and who may not want to admit that they have corona or are threatened by corona, I am asking you to please go to your nearest healthcare facility. Why? If you have it and you're not telling anybody, you yourself, with your own interest in mind, may be affecting your family or your neighbors. This is something that we must all do. And we need your participation and for you not to be fearful. The government has put the requisite facilities in. We have accomplished the first part of our strategy, which was to slow down corona from coming into St. Lucia in order to give us time to put Victoria Hospital and to be able to get the doctors and nurses here and to be able to get additional equipment to support that. Those things are now in place. We all need your help to be able to protect everyone. And let's work together and slow down and beat corona.
Thank you very much, Honorable Prime Minister. Thank you very much to the CMO. Thank you to the Commissioner of Police as well. Let me just recap our key takeaways of today. St. Lucia has now recorded to date 9 cases of COVID-19. The Honorable Prime Minister has extended the curfew from 8 p.m. to 5 a.m. The Honorable Prime Minister has also extended the quarantine period to April 14th, and all liquor licenses will be suspended. Please stay tuned to the Command Center for an update in Creole on the information we received today. Thank you.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Neptune, moi c'est officiel pour communication au département pour sortir. À présent, moi j'ai fait affaires de l'adresse de officier pour médical ministère de santé. Dimanche le 29 mars, place Richard Ezra Long à l'hôpital OKU, te bay rapport de 5 cas 9 de maladie COVID-19. À présent, ça a mené musique case maladie COVID-19 à cette liste pour des 9. À de ces 5 cases 9 là, première c'est une femme qui 24 l'année de l'âge et ni l'histoire voyage hors New York. Femme ça là aussi était en quarantaine la Kylie. Vendredi, le 27 mars, il était visité en facilité santé côté yo fait l'examen pour COVID-19. Deuxième cas là, c'est une femme qui 45 l'année de l'âge et ni l'histoire voyage de New York. Mardi le 24 mars, madame là te visité en facilité santé côté yo fait l'examen pour COVID-19. Troisième cas là, c'est une madame qui 47 l'année de l'âge et ni l'histoire voyage de Barbade et Dominique. Vendredi le 27 mars, madame là te visité en facilité santé côté yo fait l'examen pour COVID-19. Quatrième case là, c'est un homme qui 36 l'année de l'âge et ni l'histoire voyage de Barbade. Vendredi le 27 mars, l'homme là te visité en facilité santé côté yo fait l'examen pour COVID-19. Cinquième case là, c'est une madame qui 74 l'année de l'âge et pas ni pièce l'histoire voyage. Et bien passé temps avec personne qui ni l'histoire voyage. Vendredi le 27 mars, madame là te visité à facilité santé côté yo fait l'examen pour COVID-19. Département pour santé j'ai fait observation qui toutes ces 5 cases là te découvert par ces cliniques respiratoires à ces communes là. Nous aussi ka weki ces cliniques là très bon qui a aidé pour découvrir cas de COVID-19 et pour bayo cas yo mérité. À la situation de cas 5e là, côté madame là pas ni pièce l'histoire voyage. Département pour santé kay considéré sa situation de local transmission pour maladie COVID-19 à cette liste. Département pour santé j'ani travailler hard team yo en ces communes là, côté ces cases là, pour faire assurer yo joindre tout le monde qui teni sa yo ka kouye contact et puis pièce ces cases là. Commencé lundi le 23 mars, cette liste commencé faire l'examination pour maladie COVID-19 au pays. Demain ça la aide cette liste à chay qu'on nous pani pour débat à sous agence pour santé publique Kawaïb la CAF. Pour faire l'examen COVID-19 là. Ça aussi, j'ai département pour cette opportunité pour visiter les affaires de l'examination COVID-19 et garder mise moun nous ça fait l'examen pour et aussi manière nous ça joindre résultat pour COVID-19 plus vite. Cette liste comme l'autre pays où les terre a expérimenté un petit problème de mener ces supplies là pour faire l'examen. Di wata ça là, gouvernement aussi j'ai fait arrangement pour servir agence CAF pour faire l'examination pour COVID-19. Les vini pour agir et puis maladie COVID-19. nous avons chaque changement un système santé. Mam public là ça aussi service 311. Côté yo sa couiller et joindre information à ce COVID-19 et information à ce côté yo sa joindre ka et support commencer l'aider les 3 mars. Service 311 qui est available tous les jours pour 7 heures pour 7 jours, pardon, et moun sa couiller à 7 heures bon matin pour men with sway. Pour moun qui ni signe di flu, yo aussi sa joine ka hod se clinique respiratory, ça c'est polyclinique Gozilea, Centre Santé La Clery, l'hôpital Denwy, Centre Santé Vieux-Fort et l'hôpital Soufouyer, service santé hod l'hôpital Denwy et Soufouyer, et puis Centre Santé La Clery et Vieux-Fort, qui est available lundi pour vendredi à 8h bon matin pour 4h après-midi. Polyclinique Gozile qui est available tous les jours et week-end à 8h bon matin pour 4h après-midi. Service clinique respiratory aussi available à l'hôpital Victoria et St. Jude pour moun qui ni problème de pour respiration et bouise ka di water côté c'est l'autre clinique respiratory fermé. Toutes ces cases pour respiration qui viennent à se faciliter l'hôpital ka fait ça yo ka couiller screening et ka voyo côté yo mérite ça. Dernièrement, vendredi le 27 mars, cette liste te recevoir 103 professionnels médicaux hot Cuba pour aider goumer contre maladie COVID-19 en cette liste. Ces professionnels médicaux là qui resté 14 jours en quarantaine avant de commencer à faire travail au pays. Département pour santé qui aussi continue à même public la information qui vient available. Go ahead.
Yeah.
Bon après-midi tout Saint-Lucien. Police nous a rapporté que semaine passée toute police était en les chemins, toute police était dehors et moi ka oui merci yo pour ça, oui yo était là pour faire qui tout le monde obéit loi qui est passée. Ça c'est loi pour rester en dedans et puis pour ça nous a couiller social distancing, ça c'est côté où pas supposé plus près de 6 pieds y'en a l'autre, spécialement si ou a dans un supermarché ou a dans y'en a ces côtés ça là. Ça nous t'est aussi ouais c'est battre qu'à continuer ouvert semaine passée et puis moun moi pas savoir si c'est parce que tête à dans chaud mais yo t'es qu'à aller en ces bar qu'à boisson. Nous avons rapporté semaine passée aussi police marin, ça nous a couillé marine police, yo te point yon boat avec boat ça en la prise marine police. Nous aussi te arrêté vendredi à 2h bon matin, ça c'est 2h bon matin, ça c'était arrêté des noms Gozile parce que ça pas te les pour yo te en les chimère. Nous aussi assisté c'est ministre santé pour mener d'autres moun nous te un rapport qui était sorti matinique et puis yo te entouré illégal. So tout ça et puis nous te en chay moun qui pas obéir ça yo tenu pour obéir. So nous ka dit et puis commencer prochaine semaine qui va venir, semaine nous jardin, là nous caille police caille plus sorier en les travail ça pas mine pas te sorier mais yo te cassé since bagay ça te neuf nouveau so yo te ka parler puis moun one moun di yo pas faire si pas faire ça mais comme lundi premier ministre a annoncé la kaini yo kay condamner moun pour moun qui pas obéi loi kon curfew a. Ça il a fait aussi c'est mener curfew a monté from 11h pour 8h au soir. So plus bonheur moun ni pour rester la caillou. So il a couillé en les police pour faire ça nous ni pour faire et puis nous avons assez nous a parlé bay moun de nous aller un côté de les 3-4 fois pour même jour à kay di moun pour faire mais ça va faire encore moun de pour pas ka obéir nous kay prend et puis nous kay arrêter et puis maintenant l'audience moi voulais dire qui pour moins temps ou kay nous kay arrêter pour c'est 3 jours c'est petit tout 72 net du temps et puis si l'on manière y aller les nous parler puis magistrat nous pétien nous pour pli avant l'audience ouvert. So moi ka appel pour moun pour pas quitter ça ivo en semaine lundi pas quitter ça ivo so just obéir just coûter ça on est pour faire et puis ou pas kay ni pièce problème et puis loi moi ka vle à présent pour dire toute police nous ka moi ka souhaiter yo bon souhait et puis chebe wed nous pas ka moli et puis là ni bon bagay qui ka vini devant so les nous faire toi hay ça là nous kay enjoy. Merci.
Et puis c'est comme ça nous venons au bout discussion ça la jodia nous voulons remercier tellement et puis nous kay welcome.